I
Go ahead.
consent. Um, so
Let me see it.
I'm hoping that this is going to be my last update for a little while. Um, it has been another you know good week in terms of numbers and in terms of vaccinations. And, things are really moving in a good direction for us here in Ontario and Halton in Canada. I think that there's definitely a lot to celebrate. So, kind of thinking back to where we were and maybe some of the lessons learned and kind of maybe a bit of reflection on what the future might hold. So the first COVID case in Canada was diagnosed in January of 2020. I think it was January 22nd. Doesn't necessarily mean that there wasn't COVID here before. There might have been. Certainly, we know that there was COVID in the U.S. a lot earlier than what was initially reported. But in Canada, the first case was diagnosed in 2020 with someone that had arrived to Canada from China. Um, and the numbers just kind of, it was a couple of cases here and there. We were all sort of ear to the ground in the medical community, wondering what this thing was and what this was going to mean. Certainly, we were watching countries like Italy and the U.S., especially places like New York, where the cases were rising rapidly. And the severity of what we were facing started to become clearer and clearer. And then it was March, and there was March break, and I remember canceling my trip to Florida with my sister, and because as a personal choice, like there was the borders weren't closed then. People were free to travel, and it was okay to do that. But sort of out of an abundance of caution, we canceled that trip. And then when March break ended, it just didn't end. And so that was when everybody stayed home, and that was the kind of beginnings of the lockdown. And we watched cases climb during that time, primarily in long-term care facilities. And so that was the tragedy of the first wave of the pandemic. It was seeing cases of COVID running rampant through long-term care facilities, and seeing the utter devastation that can be caused by that disease in frail and vulnerable individuals, especially the elderly. And so, mortality rates in people who were over the age of 80 were 20 or 30% in a lot of cases. There were long-term care facilities that lost 20% of their patient population. I mean, it was absolutely devastating. Um, and so it was heartening for me to hear that the new health minister was acknowledging that they had failed long-term care, that they had failed the families, that they had failed to protect some of our most vulnerable citizens kind of during that time. And so, the hope kind of moving forward is that those lessons are learned, and we move away from crowded facilities and inadequately staffed long-term care facilities, and having adequate access to personal protective equipment early on, and all of those things that were absolutely kind of essential for stopping that spread. And that wave passed, and then last summer was pretty quiet. Like from a COVID perspective, people were out, we were on patios, we watched the numbers. I remember doing a couple of these where we were, in the two digits of COVID cases for the province of Ontario. Then September came, we went back to school, and the cases started to rise again, and they sort of slowly came up and up and up. September, October, November, December, and then the decision was made again to stay home. Um, and it was watching those cases kind of peak in January, and that was really the second wave. So that was the same variant that had circulated the first time around, but where we had locked down and sort of made that wave come down, opening up, and a lot more people interacting with one another caused that second wave. Um, and then hot on the heels of that came the third wave, the really devastating wave. And that was, really the last few months, the story of the last few months. And things opened up pretty quickly in February in the province of Ontario, and that may have contributed to the rapid spread of COVID-19. But more than anything else, it was the emergence of new variants that were highly contagious, much more transmissible, and tended to make people a lot sicker than the variants that had been circulating in 2020. So that really was the story of the third wave, more than anything else, was those the variants that were more contagious. But what was kind of amazing to me with the third wave was seeing how few people over the age of 80 got sick and how few people over the age of 80 died during that time. Lots of people did get sick, but as vaccinations started rolling out in December and January into long-term care facilities and into the most vulnerable in our population, the deaths in those demographics started to fall. And as the vaccine has been rolled out into younger and younger people, the incidence of illness, the incidence of death, all of those things are falling in those demographics as well. And so, right now, I think that we are in a good position moving forward. The vaccine is obviously really effective at preventing death. It's really effective at preventing hospitalization. And so, what will the next little while look like? So today we're entering into phase 2 of the reopening. That means outdoor gatherings of 25. It means small indoor gatherings of up to 5 people. It means that you can get your hair cut, you can get your pedicure, you can sit with 5 other people on a patio instead of 3 other people on a patio. And there's increased capacity in retail. I think amusement parks and water parks are opening up. So, lots of things that can be done, outside and with distancing and all of those things. So a lot of the same principles still applying, but sort of slowly and cautiously allowing more freedoms. The other thing that I kind of didn't speak to last week, but maybe is important, the Public Health Agency of Canada has issued an infographic about kind of what's safe if you're vaccinated or if you're in a group of people that are fully vaccinated or partially vaccinated. If you haven't taken a look at that, it maybe is helpful to take a look at. That, of course, also needs to take into consideration any of the local kind of public health guidelines, right? It doesn't supersede that, but it's sort of giving people a bit of a guideline or a framework for what it might look like moving forward. So, outdoor activities where, you can be in the fresh air and whether it's at a campground or having a picnic or those kinds of things, groups of fully vaccinated people don't need to mask or social distance. The Public Health Agency of Canada is suggesting even groups of people who are not fully vaccinated could also do those kinds of activities without masking or social distancing. And it's interesting, there was a lot of criticism that was raised about the terminology that was used, which they said people could consider doing those activities as long as everybody was comfortable with that. And there was some confusion about that, but I guess I would maybe clarify that to say that level of comfort is maybe an opportunity to have a conversation about what people are comfortable with. If you're within a group of people that are vaccinated or partially vaccinated or fully vaccinated, maybe that level of comfort is all about sort of asking about what consent looks like in sort of age of COVID. I'm fully vaccinated. Are you comfortable if I take my mask off? Or I know that you are fully vaccinated, but I am still more comfortable if we leave our masks on. Right? Because those are going to become important conversations. So maybe that level of comfort is about consent more so than trying to muddy the waters about what's allowed and what isn't allowed. And the infographic kind of goes on and addresses indoor activities with small groups, indoor activities with larger groups for fully vaccinated and partially vaccinated people, and I think it is providing some good sort of general guidance for what it might look like moving forward. Another thing that we're sort of thinking about as well is what it means to be a COVID long hauler, and so that's going to be a big question for those of us who are in medicine, but for those of for everybody, because we are seeing patients who months or even at this point a year after their diagnosis are still experiencing some long-term symptoms, whether that's muscle weakness or chronic cough, shortness of breath, you know just those kinds of long-standing symptoms that started when they had the original disease and didn't resolve completely. And so there's a lot of research and thought going into what it looks like to be a COVID long hauler, and how we might treat those patients, and how we might, whether they need some form of kind of rehab or just sort of medical treatment to improve their symptoms and their quality of life long term. Um, Future disease. So, it's certainly looking at the UK, looking at Israel. We are seeing sort of, large surges of the Delta variant in those countries. But although there are lots and lots of cases of COVID in those countries, um, the numbers of hospitalizations and deaths are flat. So you're seeing rising cases, but you're not seeing the similar rise with hospitalizations
Oh,
and
okay. That's good.
and
Yeah.
so that's really good news, because vaccines aren't perfect. The flu vaccine isn't perfect. There will still be breakthrough cases of flu every year. Even when everybody's immunized, some people still get sick of flu. But if it keeps the symptoms mild and it keeps people out of hospital, and COVID becomes more like a cough and a cold that sometimes in certain people causes severe illness, then that again I think is winning the battle, for lack of a better word,
Mhm.
right? Um, when people are vaccinated, even if they get the Delta variant, they're more likely to just have a runny nose and a sore throat for a few days and then get better. That's a cold, right?
Mm.
Yeah.
And if that's what COVID looks like moving forward because of vaccination and what sort of science has been able to do, then I think that there's a lot of reason to be hopeful and optimistic for the future. So it has been a heck of a 16 months, 18
Wow.
months, I guess, at this point. I don't think we're done, right? I think that this will continue to um, affect our lives significantly, kind of into the future. But I think that we know what we're up against now, and we actually have a far richer and more effective toolkit now, certainly than we did a year ago. So I remain hopeful. I really do.
Two, two quick comments.
Mhm.
Um, the U.S. has had more deaths from COVID than the combined deaths from World War One, World War Two, Vietnam, and Korea.
Mhm.
And that's a really, really historic event. The second comment is, how are you so darned accomplished? Is that a triathlete shirt you have on?
Oh, it is. Yes.
Oh my, really? You're a triathlete? Wow.
Yeah. Yeah. I mean, yeah. I guess.
Wow.
It's yeah. Just it's how I stay active. I like to have
Wow.
something.
That's really active.
I like something to work towards.
Wow. Yeah, I walk the dog to get the mail.
Every step counts, Frank. Every step
Yeah.
counts.
Okay.
And
Wow.
do we know yet? Do we know yet that if you've been vaccinated, that COVID long haul still happens? Like, does it still linger like that?
Well, that's a good question. I don't have the answer to that. Most of the COVID long haulers are people that sort of were infected before there was
Mhm.
extensive vaccination, especially being doubly vaccinated. There is some data to suggest that being vaccinated after you've had COVID, if you do have long haul symptoms, that it can improve your symptoms and improve your outcomes. Yeah.
Okay.
So Anna, do you see from the past 18 months, do you see your own practice changing in terms of how you do your practice?
Um, I think one of the things that's been kind of significant for me is kind of actually being really healthy this year and not being sick, right? And so even with like non-COVID infectious symptoms or infectious diseases. So, I mean, I suspect that I will continue to wear a mask in my practice, kind of for a while. Even fully vaccinated, even when I'm interacting with kind of fully vaccinated patients, you know, I think I'll probably continue to do that. I suspect that some of the virtual care and the telephone medicine will continue to be part of our practices moving forward. Certainly, most of the family practices are moving towards seeing more and more patients in person at this point. As people feel sort of more comfortable coming out. But we've definitely learned that there are some things that can be handled over the phone, and there are some things that can be handled, over the computer. And especially when there's a patient preference to do it that way, I think that that's fantastic, right? So I have a lot of sort of, and it's been a lot of the sort of like, busy parents, right? People that are working and that sort of thing that really appreciate actually being able to reach us by phone or over the computer, right? Because they then don't need to kind of worry about where their kids are going to go, or taking a big chunk out of their day to come to a doctor's office. So I suspect that will continue to be the case. Yeah.
Yeah. Well, I really like seeing you, but I really hope we don't see you in this circumstance again.
That's kind of my hope too. I sometimes joke to my patients that your goal as a doctor sometimes is to work yourself out of a job, right? Like, if you can get people kind of like going and on their way, then that's a good thing, right? If they need you less and less, then you're actually doing your job well. So yeah, if you guys don't need me to do this anymore, I will also be happy.
Your mom and dad in Kitchener still fine?
Yeah, they're doing good. Yeah, they really are. Yeah. Yeah.
Well, Anna, we are very grateful that you took your extremely busy time and did this for our church. So
My
thank
pleasure.
you.
Yes.
Okay. Have a great summer, everyone.
Thank you, Anna.
Thank you. Bye.
Take care.
Bye, guys.